Hello, my name is Michaela Lewis, and I'm doing my video submission project on ADHD, also known as Attention Deficit Hyperactivity Disorder. ADHD is a chronic condition that affects millions of children and often continues into adulthood. It includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior. While it does require a medical diagnosis, especially if you want to get some sort of treatment, symptoms may include limited attention, hyperactivity. For behavioral symptoms, there are like aggression, excitability, fidgeting, impulsivity, irritability, lack of restraint, or persistent repetition of words or actions. For cognitive symptoms, there may be absent-mindedness, difficulty focusing, forgetfulness, problems paying attention, or short attention spans. Mood-wise, they may be very angry, anxious, there's boredom, excitement, mood swings. Other common side effects are depression and learning disabilities. Now, it's usually diagnosed in childhood and lasts into adulthood, and the worldwide prevalence of adult ADHD is estimated at 2.8%, according to a 2016 study. In a 2019 study, adult ADHD prevalence was estimated at 0.96%, which is doubling from 0.43% a decade earlier. The estimated number of children ever diagnosed with ADHD, according to a national 2016 parent survey, is 6.1 million, 9.4%. This includes 388,000 children between the ages of 2 and 5, 2.4 million children between the ages of 6 and 11, and 3.3 million children between the ages of 12 and 17. Boys are more likely to be diagnosed with ADHD than girls, at a 12.9% versus 5.6% for girls. Now, while the treatments won't cure ADHD, it can help a lot with the symptoms. The treatments usually involve medications and or behavioral interventions, and the earlier the diagnosis and treatments are done, the more of a difference it's likely to make. About 3 in 4 children in the US are currently receiving some sort of ADHD treatment. The treatments include medication and talk therapy, such as a support group, cognitive behavioral therapy, anger management, psychology counseling, psychoeducation, family therapy, applied behavior analysis, or for the medications, things like stimulants, cognition enhancing medications, and antihypertensive drugs to lower the blood pressure. In addition, more than 2/3 of people with ADHD have at least one other coexisting condition. This includes things like disruptive behavior disorders, mood disorders, anxiety disorders, tics or Tourette syndrome, learning disorders, sleep disorders, substance abuse, depression, etc. Children with ADHD may also struggle with low self-esteem, troubled relationships, and poor performance in school. According to a national 2016 parent survey, 6 in 10 children with ADHD had at least one other mental, emotional, or behavioral disorder. About 5 in 10 with ADHD had a behavior or conduct problem, and about 3 in 10 with children with ADHD had anxiety. Another condition that affects children with ADHD is being on the autism spectrum. So, a lot of people have it. A lot of times it continues on. And you kind of just got to either deal with it or try and treat the symptoms. Thank you.